Good afternoon, namaskar, and welcome once again to another episode in the series Illness to Wellness. We've been carrying on these webinars since past 2 years and we crossed the mark of 100. We have touched almost all topics of importance to our viewers, to our listeners, ranging from immunity to COVID. And these webinars have actually been the lifeline of many of you who are still together with us, especially during the COVID period, during the period of lockdown, when we could not venture out, when there was no information available to us. And these webinars in the Illness to Wellness series were giving us authentic information, uh, right from the best sources, not only in our country, but I would say from the world, as we had some of the best specialists in various fields of medicine guiding us, answering our questions in these webinars. But even before that, we have been doing contact programs, we have been doing health camps, we've been doing screenings, and before that, before the lockdown, we've done hundreds and hundreds of camps in which we have screened more than 16,000 people for diabetes, for non-communicable diseases, blood pressure, cholesterol, thyroid, and various other diseases. And thousands of people have actually benefited from these programs. And I'm very thankful to Sri Anil Rajputji, who's our chairperson and who's the brain and who's the force behind these programs. Before the webinars, also, he is the chairman of the CSR Council of SOCHM. So, sir, over to you. Thanks for being with us, and I would request you to begin the program. Over to you, sir.
Thank you, Dr. Rajesh Kesriji, who has been my partner for, I think, last 5, 6 years in conducting these programs. Really grateful to you for sparing your valuable time for us. I take this great opportunity in welcoming Padma Shri Dr. Sanjeev Bagai, Pediatrician Chairman, Nephron Clinic, Dr. Paras Gangwal, gold medalist, MBBS, MD Medicine, consultant physician, internist and intensivist, and Dr. Rajesh Kesri, founder and director, Total Care Control, Delhi NCR, EC member, RSSDI. And good afternoon and a warm welcome to the webinar to all the participants on waterborne diseases, prevention and symptoms, JAL, Jeevanu or Jeevan, organized by SHM under its Illness to Wellness campaign. Illness to Wellness is a national health and wellness program campaign which, through numerous programs, as Dr. Kesri mentioned, on several key issues, have delved deep into the crucial subject of health. Over the years, we have been fortunate to have leading doctors, medical practitioners, and wellness experts to talk to us on critical health issues and healthy living. I thank them for their unstinted support. It is indeed inspiring that strengthen our agenda to help more and more people of all ages to stay fit and create a healthy environment. Today, our esteemed panel of doctors will talk about disease which occurs due to contamination of water, better known as waterborne diseases. We all know that among the many things that are essential for our life, water stands out as the most critical. Our lives are intrinsically related to water because 60% of our body is water. Each day, humans must consume a certain amount of water to survive, and this consumption of water should be of certain acceptable standards. If not, then this life-giving liquid could turn out into most lethal, life-taking fluid. Every year, waterborne diseases afflict hundreds of millions of people. The World Health Organization estimates that 80% of diseases worldwide are waterborne. Waterborne illness can cause a variety of symptoms, while diarrhea and vomiting are the most common. Commonly reported symptoms. Other symptoms can include skin, ear, respiratory, or eye problems. Poor water quality becomes inevitable when water gets polluted with industrial waste, human waste, animal waste, garbage, untreated sewage, chemical effluent, and so on. Drinking or cooking with such polluted water leads to diseases and infections like diarrhea, typhoid, viral hepatitis, and cholera. Contaminated water can also carry bacteria like E. coli, which leads to food poisoning. Unclean water can also cause various skin infections and contagious eye diseases, such as trachoma, that can lead to visual impairment or blindness. If such disease conditions are left untreated, they could translate into larger outbreak causing a public health emergency. India too suffers from a high burden of diarrhea and other waterborne diseases due to unsafe water, inadequate sanitation, and poor hygiene practices. It is estimated that around 37.7 million Indians are affected by waterborne diseases annually. 1.5 million children are estimated to die of diarrhea alone, and 73 million working days are lost due to waterborne diseases each year. UNICEF reports that in India, the economic burden of waterborne diseases is to the tune of $600 million per year. While the role of government in improving access to safe water and sanitation is extremely important, a number of steps taken at individual level, such as drinking clean and safe water, washing hands thoroughly with soap and water before eating and after defecating, keeping food and water covered at all times, maintaining clean surroundings, encouraging the use of toilets, and taking vaccination for immunization amongst preventable diseases like typhoid, hepatitis A, polio, etc., will go a long way in having reaching health impact with reduced incidence of waterborne diseases. Decades of misuse, poor management, over extraction of groundwater, and contamination of fresh water supplies have exacerbated water stress. In addition, countries are facing growing challenges linked to degraded water-related ecosystem, water scarcity caused by climate change, and underinvestment in water and sanitation. Therefore, public awareness coupled with a multidisciplinary approach and sustainable solutions will be key to tackle this hydra-headed problem. Today, we are joined by eminent personalities who have an advanced understanding on the subject at hand. We look forward to hearing their expert views on the various aspects of waterborne diseases and recommended actions for mitigating this challenge. I once again welcome them and look forward to an enriching discussion. I wish this webinar a great success and thank you and Jai Hind. Over to you, Dr. Kesri. You are on mute.
Thank you so much, sir. Thank you so much for your elaborate and nice introduction. And you have, in fact, chalked out an outline for the program, and we are definitely going to follow up on that, and bring up the pertinent issues and discuss them. In fact, you very rightly said that water is so essential for life. I would just go a step further and say that uh, from the current scientific hypothesis and the evidences we have, we all understand that life actually emanated and started inside water. Life. And life as it is now is possible only because those living cells could come out of water and maintain the environment that is still maintained inside a cell. And those cells multiplied in numbers and forms, and ultimately we have the living beings that we see today, including us humans. But together with us humans and the complex living beings, we also have so many bacteria, viruses, and others which are causing so many problems that you actually outlined. So, but together with that, in today's discussion, we are going to literally go and take the word literally waterborne diseases, because now there's so many other aspects to water and diseases and disorders which we are facing today, uh, which could be because of the water that we are drinking. I'm sure many of our viewers would be surprised to know that it is being hypothesized that a lot of diseases like diabetes, maybe heart, because of certain aspects of the contamination of water. So today we are very lucky to have a very good panel of experts with us, and I'm sure they're going to throw more light on these. And this discussion is actually going to be very interesting, and I'm sure it would be very useful for all of you who are following us. So let us start with the common diseases that we have, and let us ask our honorable Dr. Bagai sir. So, is cholera still pertinent? Is it still a health issue? Because earlier we used to hear that so many deaths are being caused from cholera, and it used to come in waves and epidemics, and it was a cause of death and destruction all over our country. Should we still worry about cholera and such diseases?
Good afternoon. Thank you for having me. So when you look at waterborne diseases, cholera is one amongst the bacterial, and we do see it occasionally in the major metros, even in private practice, yes, but in government hospitals for sure. But in rural India, it is still very much present. It's a typical watery rice water, absolutely purulent stools. But just with your permission, if you broadly categorize, the waterborne verticals as diseases and contaminants, the bacterials would include things like E. coli, Shigella, which causes bacillary dysentery, E. coli, which causes hemolytic uremic syndrome, dehydration, acute kidney failure, leptospirosis, still very common even in major metros. Indeed, even tuberculosis. If you look at viral hepatitis A, hepatitis E, poliovirus also transmits through water. And now we know that COVID-19 is also transmitted through sewage and fecal contamination. Parasitic infections such as guinea worms, roundworms, pinworms, tapeworms, algae, protozoal infections, the time immemorial old infections of amoebiasis and giardiasis, and then fungal infections. Let us not forget two very important verticals which very often are neglected. One is heavy metal contamination, which is mainly lead and mercury, which is long-term studies have shown to have a huge impact on the mental status and development, especially of children. And the second is microplastic. And we are living in a plastic world. This microplastic seeps through soil, goes into the underground water, and if people have impure or contaminated water, this is an anti-hormone. So it destroys your estrogen in the body and causes long-term serious effects. So yes, your basic question, cholera, very much there. We have to keep a very high index of suspicion. And the carry home message in this your question is what I call as WASH, WASH, water and sanitation hygiene, key to long-term safety. I think you're on
You
mute.
are on mute. You are on mute.
Thank you, sir. I think that was a very elaborate outline of the topics that we should be discussing, and I'm sure we're going to have a lot of discussion. Dr. Paras, sir, you being an eminent physician, please tell us the symptoms people face when they have these bacterial or viral problems, or are there some common symptoms? And also tell us about some red flags that people should actually be worried about. When should they rush to hospital? Do they need to rush to hospital? So tell about some of the clinical aspects which in your opinion patients or viewers should be knowing. Dr. Paras, unmute yourself, sir. I think you're muted. No?
I don't think he's audible.
So we can't hear you, Dr. Paras. I think there's some problem in the connection with the, or maybe you can just take it off and speak.
Rajesh, am I audible now?
Yes, yes. Now you're audible. Now you're perfectly audible. Yes.
All right. So thank you for bringing up this wonderful topic of uh, water safety and waterborne illnesses. Because what I understand as a physician, these days, most of hospital admissions that we have of young people are just related to these waterborne and hygiene related illnesses. In this, water becomes very important component, whether we call it water safety or food or hygiene safety. I think they are one single spectrum of illnesses that we need to take care of. All young admissions in hospital are mostly related to some foodborne illnesses. Foodborne illnesses mean waterborne illnesses because of poor hygiene standards, poor sanitation, and these are the common causes of youngs being admitted to the hospital, even the old age people, because we have too much of this culture of ordering food outside. We had, what I would like to bring to people notice is, we used to have concept of safe hands, right? Safe hands used to mean what is you being served have been prepared by safest of hands. They are being served to you by safe hands. So we had old principles in our house that we used to have one sacred place in your kitchen where nobody was allowed to come and touch even, right? So that principles are now all gone. They are not being practiced so well. And now we have these waterborne illness because of poor water, sanitation and hygiene. So coming to your specific question, that how do these patients present and what are the red flags? So most of these waterborne illnesses are generally causing symptoms with your tummy. We call them GI sepsis, enteritis or enterocolitis. So most pertinent symptom of them is going to be abdominal pain, some cramps, uneasiness. Somebody would have symptoms of nausea and vomiting. Somebody would have abdominal cramps followed by loose motions, diarrhea, or if it is very severe, we call it dysentery. So these are the common symptoms. Because of these, patient would have, uh, if they are bacterial illnesses or viral illnesses, further progression would be in terms of fever and further progressive ailments. They can have a widespread uh, manifestations if they are progressing further to cause severe sepsis. When the infections gets more severe, they can cause you lowering of the BP, they can cause you breathing discomfort, they can cause you decrease in your urine output. So to keep it simple, if you have foodborne infections then or waterborne infections, then you are going to have abdominal pain, cramps, vomiting, nausea, and diarrhea. If you have repeated recurrent vomitings, you are not able to replace it with liquids. If you have profuse watery diarrhea, you're not able to replace with liquids. If you are having giddiness, if you are having some blackouts, that's the sign that means you have low BP. If you are not passing adequate amount of urine, that is the sign that you have developed so much of dehydration that even the kidneys are going into shutdown. If you are running high fever, have severe palpitations and breathing discomfort, these are going to be the red flags, then you should immediately rush to the hospital. If it is just the beginning, then a OPD visit should suffice to be taken care.
थैंक यू सर, थैंक यू। एक बार मैं हिंदी में कुछ जो बहुत महत्वपूर्ण पॉइंट आपने डॉक्टर साहब ने बताया ये फिर से रिपीट कर दूं कि अगर पेशाब कम आने लगा है, यूरिन कम आ रहा है और सांस लेने में दिक्कत हो रही है, दिल की धड़कन तेज हो रही है, बहुत तेज बुखार हो रहा है, वॉमिटिंग हो रही है, वो रुक नहीं रही है, या मोशन बार बार हो रहे हैं, वो रुक नहीं रहे हैं, तो ऐसी परिस्थिति में मरीज को अवश्य तुरंत जल्दी से जल्दी हॉस्पिटल लेके जाएं, क्योंकि ऐसे मरीज का घर पे इलाज हो सकता है संभव ना हो, और समय अगर हमने ज्यादा समय खींचा, देर करी, तो फिर बहुत परेशानियां हो सकती हैं। एम आई राइट डॉक्टर पारस?
Yes,
to
बिल्कुल सही
outline
कहा आपने।
the red flags
अभी
and
हमारे जितने भी यंगस्टर्स हॉस्पिटल में भर्ती हो रहे हैं,
जी
उनके भर्ती होने की सबसे मुख्य वजह सिर्फ पुअर हाइजीन स्टैंडर्ड्स, पुअर वाटर एंड कंटामिनेशन है, जो हम सबको टेक केयर करना चाहिए। मे बी मैं एक स्टेप अगर आगे जाऊं तो जो लोग आपको खाना सर्व कर रहे हैं, जो लोग आपका खाना बना रहे हैं, चाहे वो आपके हॉकर्स हो, स्ट्रीट हॉकर्स हो, चाहे आपकी फूड सप्लाई चेन वाले लोग हों जिनको आप डिफरेंट ऑनलाइन ऑर्डर्स में करते हैं, आई थिंक सबसे पहला पार्ट होगा कि हम सबको मिलके उन सबको एजुकेट करना जरूरी है जो हाथ हमें खाना खिला रहे हैं, जो हाथ हमारा खाना बना रहे हैं। आई थिंक एसोचैम कैन टेक दिस एंडेवर फर्दर of training the people who are serving us the food, training the people who are making the food for us. They should become our first target if we want to prevent these water and foodborne illnesses.
wonderful. I think this is a great and a wonderful suggestion, and fortunately we have Shri Anil Rajput sir with us, and he'd be able to guide us and take this on further. Sir, coming over to you, Dr. Bagai sir, because you are a nephrologist and you also deal with kids with kidney problems. So do you see that कि बच्चों में इस प्रकार की प्रॉब्लम ज्यादा होती हैं और फिर उसका किडनी पे भी कोई खराब असर पड़ता है?
Ji. Now, is it okay if I speak in English?
Yes, yes, it's fine.
Okay. So I think the maximum impact of any waterborne disease is on children. India loses more than 1.5 million children under the age of 5 every year. That's a ridiculous number of deaths for something which is largely preventable. So when I say it's preventable, it's either through prevention in terms of hand washing, storage of food, cooking of food, or drinking contaminated water. The previous panelist has beautifully illustrated the commonest symptom are GI symptoms, which are nausea, vomiting, profuse diarrhea with or without blood. And what it does is it depletes your water table in the body. Especially the smaller children then cannot keep up the pace of rehydrating themselves because their body volume is that much limited as compared to adults. And gradually you go into stage 1, 2, 3, and then gross dehydration, and then indeed shock. When you are treating dehydration or looking out for signs of dehydration, especially in smaller children, there are two cardinal signs to look out for as parents or young parents or even elderlies to look out for children. One is alertness of a child. If a child is not feeling well, is not feeding adequate amount, not retaining adequate amount, and not passing adequate amounts of urine, that's an important sign. Also, remember, fever makes you more dehydrated. So, infection causes fever, and fever causes an increase in your basic metabolic rate, and it further dehydrates you. So, I think early intervention is really the key to simple solutions known as ORS, that's oral rehydration solution, easily made at home, and it can save million lives if it is done appropriately and in a timely manner. But going forward, once the dehydration is already there, children's kidneys are very susceptible. And the reason they are susceptible is they are not as matured as what we call your filtering fraction as compared to adults. Sorry. And gradually, more quickly as compared to adults, gradually these children start losing significant amount of kidney function. There are specific bacteria which specifically cause specific illnesses from the kidney point of view. Like E. coli is known to cause what we call as hemolytic uremic syndrome. That's an acute shutdown of the kidney with low platelets. Salmonella again is supposed to cause kidney damage. Shigella as bacillary dysentery also causes. But there are other viral infections also which can involve the kidney. Once these things start a cascade of a kidney damage, it also causes in many cases an autoimmune phenomena in which other organs are involved, like liver, like lungs, like heart, like brain. So your key message for people who are listening to this is early diagnosis, early intervention, apart from prevention. And if you rehydrate, especially a small child, quickly, this is almost magical in terms of recovery. The main ingredients which are lost from the body are salts, which is sodium and chloride and potassium. So it is not unusual for us to see in a severely dehydrated child, these children run very, very low sodium and chloride, very low potassium. So it's supplementation in a calculated manner, rehydration in a calculated manner to save lives. Over to you.
Thank you, sir. Thank you. And quickly over to you, Dr. Paris. Sir, I just request you to bring up certain issues which people might not even ever suspect that these diseases are because of the waterborne infections, like epilepsy. Few of common epilepsies all over our country are actually from some certain what. Please elaborate on this.
Yeah. आई थिंक हम सबको यहाँ तक तो पता है कि पेट दर्द हुआ है, लूज मोशन हुए हैं, तो हमें फूड बॉर्न या वाटर बॉर्न इन्फेक्शन हुआ है. बट कई बार हम जब खाना खाते हैं या कोई भी आउटसाइड सोर्स से सप्लाई खाते हैं जो अनहाइजीनिक हैंड से हमारे पास डिलीवर हो रहा है, या कई बार हम घूमने जाते हैं तो हमारे को सैलेड सर्व किया जाता है, या सपोज कीजिए गाजर काट के दी जाती है या अमरूद काट के दिया जाता है, या हम कई बार घूमने जाते हैं when we are in out and we have directly grown vegetables which are there, we get tempted to eat them raw and we have unhygienic hands that time. उस समय में हाथ इतने धुले हुए नहीं होते, वो सब्जियां या वो फल भी इतने धुले हुए नहीं होते, लेकिन हाँ सीधा नेचर से डायरेक्ट खाने की टेम्पटेशन में हम उनको कई बार खाते हैं, कंज्यूम करते हैं. तो हम सब ने सुना होगा कि दिमाग में कई बार कीड़े हो जाते हैं और उनसे दौरे पड़ते हैं. जैसे हमारे कोई बहुत सेलिब्रिटी लोगों को भी ये सब बीमारियां हुई हैं. तो ये एक बीमारी होती है जिसको हम बहुत कॉमनली न्यूरोसिस्टिक सर्कोसिस बोलते हैं, और ये वर्म इन्फेस्टेशन से होता है. जो पेट में रहने वाले हमारे कीड़े होते हैं, एक को हम राउंड वर्म बोलते हैं, एक को हम फ्लैट वर्म बोलते हैं. तो फ्लैट वर्म मतलब टीनिया सोलियम, जो कि अधिकतर लोग ये मानते हैं कि पोर्क मीट खाने से, वो पोर्क मीट में बहुत कॉमनली होता है क्योंकि सुअर जो होता है वो कंटेमिनेटेड चीज़ों को ही कंज्यूम करता है और वहाँ से वो उसके अंदर चले जाते हैं और उस पोर्क मीट में वो कीटाणु के कण आ जाते हैं, जिसको कि हम सिस्टिस सर्काई बोलते हैं. उसकी मसल्स के अंदर होते हैं. अब हम जब उसको खाते हैं तो वो हमारी बॉडी में जा करके एज ए टेप फॉर्म डेवलप होता है, और इस टेप फॉर्म के फिर दोबारा से छोटे छोटे पीसेस जो हैं वो फिर हमारे मोशंस में सिक्रीट होते हैं. और ये सब बहुत माइक्रो लेवल्स पे हैं, बहुत छोटे हैं जो दिखते भी नहीं हैं, और ये सिर्फ हमारे जहाँ हम एक्सक्रीटा अपनी पास करते हैं, हमारे स्टूल्स पास करते हैं, हमारे खुद के हाथ भी गंदे हो सकते हैं, तो हम ऑटो इनोक्यूलेट भी कर सकते हैं। जहाँ जहाँ हमारी एक्सक्रीटा जा रही है उसको साफ सफाई से नहीं किया गया, चाहे वहाँ सब्जियां उग रही हो या कुछ भी उग रहा हो, जैसा कि हिंदुस्तान में बहुत कॉमनली होता है कि हम खेतों में जाते हैं और मोशन पास करते हैं, और अ, अ, तो वहाँ की सब्जियों या फलों पे अगर वो प्रॉपरली हैंडल नहीं है, वॉश नहीं है, तो वो एक्सक्रीटा वाले वो लग जाएंगे, जिसके अंदर के कीड़े के ये बोल सकते हैं कि बीज हैं, जिनको प्रोग्लॉटिड्स बोलते हैं और सिस्टिसरकाई बोलते हैं। तो जब हम बिना धुले हुए हाथों से उन बिना धुली हुई सब्जियों या फलों का सेवन करेंगे, जैसे अधिकतर लोग बोलते हैं कि कैबेज नहीं खानी चाहिए बिकॉज वो इतनी नंबर ऑफ लेयर्स में होती है दैट इट इज वेरी टफ टू क्लीन इट, तो वो प्रोग्लॉटिड्स अब हमारे अंदर चले जाते हैं और फिर वो वहां पे सिस्ट डेवलप होते हैं। वो सिस्ट हमें ट्रेवल करके मसल्स के अंदर जा सकते हैं, स्किन के अंदर जा सकते हैं, आईज के अंदर जा सकते हैं और ब्रेन के अंदर भी जा सकते हैं, और वहां जाकर के वो सिस्ट डेवलप होते हैं, उनको हम न्यूरोसिस्टिस सरकाई बोलते हैं। और जब वो सिस्ट बड़े होते हैं तो मल्टीपल भी हो जाते हैं, और कई बार उनके अंदर जो कीटाणु है जब डाई आउट करता है तो वहाँ बहुत सारी स्वेलिंग डेवलप होती है, जिसकी वजह से हमें दौरे पड़ जाते हैं। तो इसको न्यूरोसिस्टिक सर्कोसिस बोला जाता है, जो कि टीनिया सोलियम मतलब फ्लैट बॉम्ब से हमें होता है। कहने का तात्पर्य ये है कि हमें जो खाना है वो साफ सुथरा खाना है, जो खाना है उसको धो करके खाना है, जो खाना है उसको साफ हाथों से खाना है। हमारे को साफ हाथों से ही खाने का सेवन करना चाहिए, हमें खाना परोसने वाले हाथ भी साफ होने चाहिए और हमारे खुद के खाना खाने वाले हाथ भी साफ होने चाहिए। इस प्रिंसिपल का हमेशा ध्यान रखना है। बीमारियां बहुत सारी हैं और ये सब जैसा डॉक्टर बघेई ने भी बोला और डॉक्टर राजेश केसरी ने भी बोला, ये सब प्रिवेंटेबल हैं और देयर आर मिलियंस ऑफ पीपल डाइंग आउट एवरी ईयर। हम सब ने कोविड में इतना हड़कंप मचाया प्रिवेंटिंग पीपल फ्रॉम डाइंग, बट अगर हम कोविड वर्सेज इन बीमारियों की बातें करें तो ये सब बहुत आसानी से प्रिवेंटेबल है। शायद कोविड को प्रिवेंट करना मुश्किल था, इनको प्रिवेंट करना और बहुत आसान है अगर हम इंडिविजुअल लेवल पे अपनी जिम्मेदारी निभाएं और लोगों को जागरूक करें, और जिन हाथों से हम खाना खा रहे हैं उनको अच्छा साफ वाटर प्रोवाइड करवाएं, जिससे वो सैनिटेशन को कंप्लीट कर पाएं। ये हम सबकी जिम्मेदारी होनी चाहिए।
वंडरफुल डॉक्टर पारस, थैंक यू सो मच, बहुत अच्छे से बताएं। अब आप बात कर ही रहे हैं इस चर्चा में, तो थोड़ा सा हमें लिवर के बारे में बता दीजिए। कुछ बीमारियां लिवर में भी वाटरबोर्न होती हैं जिससे लोगों को बहुत तकलीफ होती है।
जी, तो एज ए प्रैक्टिसिंग फिजिशियन जो इन बीमारियों का मेरा बहुत डायरेक्टली सामना होता है लिवर से रिलेटेड, वैसे तो हर कोई भी इन्फेक्शन जो पेट की आंतों में होता है, तो हम बोलते हैं कि पेट की आंतों की सारी गंदगी लिवर फिल्टर करता है और उसको फिर फिल्टर करके दिल तक पहुंचाता है, ऐसा आम पब्लिक के लिए हम मान सकते हैं। तो जो मुख्य इन्फेक्शन लीवर को नुकसान करने वाले हैं डायरेक्टली, अपार्ट फ्रॉम एनी इन्फेक्शन, कोई भी इन्फेक्शन आपकी बॉडी में जब सीवियर होता है तो वो लिवर को डैमेज कर सकता है, लेकिन जो मुख्य वाटरबोर्न इलनेसेस हैं जो लिवर को डायरेक्टली नुकसान करती हैं, उसमें सबसे कॉमन हमारा अमीबियासिस है, जो हम अनहाइजीनिक फूड से हमारी बॉडी में एंटर होता है और वो हमारी छोटी आंत और बड़ी आंत वाले में बड़े बड़े जख्म कर देता है। उन जख्मों से फर्दर प्रोसीड होकर अमीबा हमारे लिवर में चले जाते हैं और लिवर में भी अमीबियासिस हो जाता है। तो इसके केसेस भी आजकल जो हम पहले देखते थे उससे बहुत ज्यादा बढ़ने लग गए हैं। तो लिवर अमीबियासिस हमारे लिए बहुत डेंजरस प्रॉब्लम है। इसमें पेशेंट को तेज बुखार आता है, उसके पेट के ऊपर के हिस्से में तेज दर्द होने लग जाता है, उसको शोल्डर में पेन होने लग जाता है, कई बार सांस की तकलीफ होने लग जाती है और फीवर अक्सर कर हाई ग्रेड होता है। तो हम एक अल्ट्रासाउंड के माध्यम से इसको आसानी से डायग्नोज कर पाते हैं और उसका फिर उचित इलाज कर पाते हैं। तो ये है अमीबियासिस का फर्दर प्रोग्रेशन होकर लिवर अमीबियासिस, जिसमें लिवर में मवाद पड़ जाता है, इसको आप लिवर का फोड़ा बोलते हैं या लिवर एब्सेसिस बोलते हैं। दूसरी जो कॉमन बीमारी हमारी है वो है हेपेटाइटिस, जो हम हेपेटाइटिस ए या ई, बाकी जो हेपेटाइटिस बी और सी हैं वो तो एचआईवी की तरह फैलते हैं, ब्लड बॉर्न इन्फेक्शन होते हैं, लेकिन हेपेटाइटिस ए और ई हमारे खाने के जरिए फैलते हैं। बहुत अच्छी बात यह है कि दोनों के ही लिए वैक्सीन, हेपेटाइटिस ए के लिए अपने पास वैक्सीन मौजूद है, हेपेटाइटिस ई के लिए अभी कोई वैक्सीन नहीं है। तो ये प्रिवेंटेबल इन्फेक्शन भी हैं। अगेन अमीबियासिस भी प्रिवेंट हो जाएगा, हेपेटाइटिस ए भी प्रिवेंट हो जाएगा, ई भी प्रिवेंट हो जाएगा। व्हाट यू हैव टू टेक केयर इज हैंड हाइजीन, क्लीन एंड सेफ वाटर, सो कीप प्रैक्टिसिंग दैट हेपेटाइटिस ए और ई अपने आप ठीक होने वाली बीमारी हैं, लेकिन लगभग 5 to 10% पेशेंट्स में ये बहुत सीवियर हो जाती हैं, जिसमें आपको हॉस्पिटलाइजेशन की नीड पड़ सकती है। पीलिया तेजी से बढ़ जाता है, आपको तेज बुखार आता है, आपको बहुत उल्टियां आती हैं, आंखें आपकी पीली हो जाती हैं। पानी की कमी हो तो फिर आपका, जैसे डॉक्टर बघेल ने बोला, पानी की कमी से किडनी पे असर आ सकता है। तो आपको टाइमली अपने डॉक्टर को मिलना है और इनका उपचार करवाना है।
Thank you so much, Dr. Aras. Dr. Bagai, we will come over to you, sir. We have had a lot of discussion about waterborne infectious diseases, which come directly through water as a result of contamination by bacteria or whatever the sources.
Gee.
Tell us something about the vector-borne diseases. So the root cause actually is water because they're rising out of water. So, and there are two very common vector-borne diseases which are prevalent in Delhi even now. So tell us a little bit on that, about
Sure.
that.
Just to add one important vaccine preventable disease which is originating from water is especially in children and mainly in infants is rotavirus. And we have a very, very effective vaccine called as rotavirus vaccine. It's an oral small ampule which is given in 3 doses to children below 6 months of age. And the efficacy is anywhere between 75 to 80% protective. So that's one more vaccine preventable viral infection, which is water or unhygienic hands. With regards to vector-borne, in fact, it could be 3 vector-borne. One is, of course, the time-old scourge of humanity, which is called as malaria. The second is dengue. And then you have 2 other groups. One is called as dengue-like, in which all tests come negative, but yet it's presenting like dengue. We call it dengue-like. And lastly is what we call as chikungunya. There is also other infections like Zika and all, which also come, but
Yes.
concentrating on 2 major ones, which is dengue and malaria. So malaria, of course, is vector-borne. We know that it's transmitted through mosquitoes. There are 4 different types of malarias. Without going into the specific details, high-grade fever, intense fever, remitting fever, headache, vomiting, with or without rash, with or without complications. But dengue is something which is peculiarly more dampening, especially in monsoon and immediate post-monsoon. And again, you have 5 different types of dengue virus, which also spreads through mosquitoes, which is Aedes mosquito, uh, stagnant water, coolers, in petri dishes, outside in pots or in near your home. These are all breeding grounds for the larva. And dengue presents basically with fever, with frontal headache, lower backache, very crushing bone pains, body ache, and very rampant abdominal symptoms, dehydration, vomiting, loose motions, and peculiarly a rash which comes in crops, it comes in phases. And when the fever breaks, the rash comes. So the mistake where common people make is when the fever is gone, they feel, the storm is over. It's not over because then the rash comes, the platelets fall. So the classical path of onset, duration, progress of this is the fever comes as a biphasic fever. So fever can come, you'll have a remitting period for 1 or 2 days, and then the fever comes back again. But when the fever starts going down, the rash comes. Sometimes in severe cases, you have low platelets, which causes petechiae, and that's what we call as dengue hemorrhagic fever in severe cases, and indeed sometimes, unfortunately, death. And then, of course, you have chikungunya, which presents almost same as malaria or dengue, but you have more joints and musculoskeletal symptoms overriding. Lab tests are available. You have antigen test, which is available for both malaria antigen and for dengue. It is called as NS1 antigen. The important message which I want to give to everyone is do not self-medicate. That's the first most important thing. What is important is you may take paracetamol as the only medicine which is the safest. But otherwise, do not experiment on combination painkillers or fever medicine. So anything which contains ibuprofen, nemosilide, aspirin, and other drugs like this are almost can be fatal because not only do they exaggerate the the symptoms of gastritis, vomiting, and inability to keep the medicines down, especially in children, but they can actually cause platelet dysfunction and wipe out your platelet count. So it can be a double whammy, so to say. Second thing is antibiotics have no role in these. So please don't start self-medicating yourself with all commonly available antibiotics which are available across the counter, which routinely should not be legally. Point number three is do not take home remedies. So in India, there is a huge wave of WhatsApp University messages which come, and through various gurus and alternative medicines which come, like fruit peels and papita and karela and loki. These are harmful. They have no proven benefit at all. Not then, not now, not in future. Get your test done at an appropriate time. Do not get your malaria test done or your dengue test done within 1 hour, 2 hours, 3 hours of fever. Let the fever present. Your dengue test comes positive as NS1 only towards the end of the first day. Your malaria test will positively come in antigen around 8 to 10 hours after the fever. So the best way forward is to consult your doctor. At home, apart from taking paracetamol, please hydrate yourself well. Take good nutritious diet. Like I said, don't self-medicate, don't over-medicate. If the fever is more than 2 to 3 days, if the fever is very high grade, if especially in children you have altered sensorium, less urine output, intense vomiting, these kind of children may benefit by 1 or 2 days stay in the hospital under close supervision. Monitor the patient's blood pressure. That's extremely important. When you ask for the lab reports, everyone should look very carefully at not only the hemoglobin, but what's called as the PCV. Your thicker the blood will be lower the platelets. So your blood gets more thick, more viscid, and therefore you go into more dehydration. So that's called as hemoconcentration. But by and large, the symptoms are normally self-limiting. It's a typical cycle of 7 days, 7 days, 7 days, and then you have a little bit of weakness. You can go back to work normally. But I must add, malaria you can get again. So it is not something that you get malaria once and for your life and you'll never get it again. You can get it again. Dengue you can potentially get 4 times or 5 times, but your every subsequent attack, what we call as ADE, antibody dependent enhancement, the next attack may be more severe. So don't be under the false belief that if you had it once, you can't get it again. Look out for long-term symptoms, especially chikungunya and all have, patients have a lot of joint pains, a lot of weakness, a lot of sometimes debilitating pain for weeks together and months together. So you need a close observation. Consult your doctor. Don't self-medicate. Time your tests appropriately. And best is don't take any home remedies. Over to you.
Thank you, sir. Thank you so much. I think that was quite an elaborate explanation. Over to you, Dr. Paras, sir.
Yeah.
You want to add
Rajesh,
something?
I would like to make one point here for the benefit of public. तो ये जो पब्लिक में एक बड़ी भ्रांति है कि डॉक्टर साहब मुझे ना वायरल बुखार हुआ है, तो दे अज्यूम कि वायरल बुखार हुआ है मतलब कुछ नहीं हुआ है. तो ये एक मिस इन्फॉर्मेशन या मिथ वायरल बुखारों के प्रति मरीज और पेशेंट कम्युनिटी को होना चाहिए. ये जो वायरसेस हैं ये नास्ती होते हैं, खतरनाक होते हैं, ये इतने आसान और सिंपल नहीं होते. आपने एक को झेला है कोरोना, उसके बाद आपको समझ में आ गया कि बुखार के बाद लंग को डैमेज कर सकता है. तो वायरसों की एक प्रवृत्ति होती है कि वो पहली फेज में बुखार करते हैं, दूसरी फेज में फिर बॉडी के किसी एक मेजर अंग पे जाकर के वो आपको डैमेजेस कर सकते हैं, राइट. तो अगर वो वायरल बुखार है तो यस, वो शुरू में उसकी इंटेंसिटी हाई होगी, 2 दिन 3 दिन या 5 दिन में अपने आप उतर जाएगा. लेकिन जब वो उतर जाता है तब आप फुल्ली रिलैक्स नहीं हो सकते जब तक कि उसके उतरने के बाद के 1 या 2 वीक आपके अनइवेंटफुल ना चले जाए. क्योंकि हेपेटाइटिस ए होगा, ई होगा, तब भी आपको तेज बुखार आएगा, बुखार उतर जाएगा 3 दिन 4 दिन 5 दिन 7 दिन और फिर आपको जॉन्डिस वाले फीचर्स आ जाएंगे, तो आपको पीलिया हो जाएगा. इसलिए आपको सजग रहना है, टू टेक केयर ऑफ योरसेल्फ. ऐसे डेंगू होगा तो आपको 2 दिन 3 दिन से 5 दिन तक तेज बुखार आएगा, कभी कभी 7वें दिन तक भी, और फिर वो उतर जाएगा. बट जब वो उतर रहा है तब वो जा करके आपकी बोन मैरो को स्तब्ध कर देगा, उसको म्यूट कर देगा, वहां पे जो प्लेटलेट्स बन रहे हैं या टीएलसी जो बन रहे हैं, व्हाइट सेल्स जो बन रहे हैं, उनके काउंट्स लोअर होते जाएंगे। आपको जनरली फीलिंग ऑफ वेलबींग आएगी इनिशियली कि मेरा बुखार उतर गया, मैं ठीक हो गया, बट उधर धोखे से आपके प्लेटलेट्स कम हो जाएंगे और आपको मेजर इंसल्ट हो सकती है, आपका बीपी लो हो सकता है। तो आपको वॉचफुल रहना है, जैसे डॉक्टर बघेल ने बोला कि फीवर के जाने के बाद रैश के लिए, अगर रैश आ रहा है, पिटिशे आ रहे हैं, तो आपको अलर्ट रहना है। पेट के ऊपर के हिस्से में अगर आपको दर्द या भारीपना महसूस होता है, तो आपको देखना है कि आंखों में पीलिया तो नहीं हो गया है, या प्लेटलेट्स चेक करवाने हैं, क्योंकि डेंगू में एक मुख्य जो लक्षण हमने देखा है प्लेटलेट्स कम होने के साथ साथ, वो पेट में पानी भरना, पेट के ऊपर के हिस्से में लिवर गॉल ब्लैडर वाले हिस्से में सूजन आना, वो आपको एक मार्कर की तरह ध्यान रखना चाहिए कि उस समय जरूर अपने प्लेटलेट्स चेक करवा लें, कहीं ऐसा ना हो कि प्लेटलेट्स ड्रास्टिकली लो हो गए हों। और इन सब वायरल बुखार का सबसे मुख्य है, फिर वही ये पानी से होते हैं, और पानी और लिक्विड इनको आपको compete कर पाएगा, इनसे आपको जिता पाएगा। तो आपको अपने को वेल हाइड्रेट रखना है, अपने को जूसेस, फ्रूट्स, नारियल पानी, ORS, electrol, energal in various forms consume करना है, so that you can beat the heat of these fever. So do not ignore viral so lightly, be on alert. जब बुखार चला जाए उसके 1-2 वीक के लिए आप अपना अलर्टनेस रखिए कि किसी और अंग में जाकर के आपको नुकसान तो नहीं पहुंचा रहा है।
बिल्कुल सही। और यस सर,
Just,
तो
just a Yeah, just a quick word on 2 points. One is, of course, we are not totally out of COVID as yet. And we know that COVID can spread through the sewage water and contaminated water, especially in children, where the vast majority of infections, almost 50% of them, are actually mild or asymptomatic, and it may just go below the radar. But what is critical is that even a mild or asymptomatic infection can present 4 to 6 weeks later with multi-organ systemic involvement, what we call as MISC in children. So continuous monitoring of children is extremely important even after a mild viral infection. And the second important point which I want to make is storage of water. There is a huge concept and a myth, it's a wrong notion people have, that if you store water, nothing happens. Storage in plastic is dangerous. Plastic bottles is not good. They should by and large use glass bottles or indeed stainless steel. Plastic leaches into the body, especially in children, and causes long-term damage, including cancers, early diabetes, infertility, disruption of pregnancies, fetal damage in an unborn fetus, and so on. But more important in India, the concept and the huge myth is to store water and heat water, especially in male children, in copper vessels. Now, copper leaches and causes long-term liver damage. So water storage, water heating in which type of utensil is important, especially in rural India. If you remember, we as children, in all over India till about 15, 20 years back, every Diwali, the person used to come on a cycle with a small little copper wire, and he used to do kalai of the vessels. It is still done in rural India in many places. What that kalai is, 100% copper-based compound. It layers the utensils. It makes you see that the vessels look pure white and silvery and shiny. But this is long-term damage. It's a well-established fact that copper causes something what we call as Indian childhood cirrhosis. So children can go into acute to chronic liver failure and indeed death. So storage of water in an appropriate utensil and heating of water in which type of vessel is equally important. Over to you.
thank you so much, sir. Now that you have already started the other phase, I would like to call it, of the waterborne diseases, that is, the diseases caused due to the quality, the poor quality, or the contents of the water that we usually drink. So I'd like to come over to you, sir, Dr. Paras Gangwal. So, what is your opinion? For example, we've heard in many of our conferences that we see the rising trend of diabetes, metabolic diseases in rural areas, and not only in people who have become sedentary. We also see such diseases rising in people who actually are hardworking, who are lean, who are not obese. So these people don't have any obvious reason for developing diabetes and metabolic disorders. So what is your take on this? Could it be because of the groundwater contamination?
Yeah. So, Rajesh, there are many theories being postulated that the groundwater contamination with various heavy metals or arsenic, as we see in them, uh, may be contributing to some hormonal imbalances that happens in the body. And then, as Dr. Bagai said, the plastics again are one of the major things which is leading to these what they call it the microplastics, which is seeping into the water and then accumulating into certain products which can harm us in very long term prospects. So this is a well known fact now that these leads to various metabolic syndromes which later develop into illnesses like diabetes and all. Raj, you are on mute.
Dr. Rajiv Singh has joined us. Sir, are you there? Dr. Rajiv Singh. Dr. Rajiv Singh. I think is busy. So, Dr. Bagai sir, I would come over to you in the meantime.
Sure.
Initially, you had talked about endocrine disruptors, about estrogen. So, what do you feel or what do you see are the problems that are being caused in the adult population, especially in females, due to these endocrine so-called disruptors?
Yeah, so the maximum burden of these endocrine disruptors, what we call as anti-estrogen, is through microplastic. So it is through your microwave utensils, it is through plastic bottles, it is even through medicine bottles. 90% of children's medicines are dispensed as syrups or suspensions in plastic bottles. So longer the fluid is in contact, at the higher temperature it is in contact, especially in summer months in India, greater is the leaching effect of microplastic into the liquid inside the bottle. What this actually does is it blocks your receptors. These microplastics contain various toxins. So the most important toxin is what we call as bisphenol A. The second one is called as phytate, DHT. Third is antimony, and last is arsenic. These are the components basically of plastic, which also sometimes includes byproducts of benzene. So what these do is it mimics in your body the effect of estrogen. It makes your hormonal profile disrupted. It causes infertility, stillbirths, prematurity. In fetuses, it causes harm of causing genitourinary abnormalities, cardiac abnormalities, premature births, low for birth weight babies, diabetes, carcinoma in situ, mainly lungs, pancreas, urinary bladder, and damage to the heart, hypertension, and others. So this is what we call as cardiometabolic effect of plastic. And in fact, Indian Association of Pediatrics 5 or 6 years back had announced the annual theme as "Say No to Plastic." So I think that's another thing which your organization can take up, is to spread the awareness of the hazards of plastic. But apart from that is heavy metals. So I think lead and mercury are two things which are contaminants, especially in rivers and seawater, or seeping in through the soil. So contamination of water, apart from the microorganisms, is equally important.
Thank you, sir. Thank you. I think this was very important and interesting, these two topics that both of you have brought up. Thank you so much. And I request Dr. Rajiv Singh. Sir, are you there? Dr. Rajiv Singh. Dr. Rajiv Singh.
Rajesh, can I please
Yes, please.
take
Please,
your
please,
leave?
sir.
I have an emergency to attend. Can I please take your leave now?
Well, thank you so much, sir.
Okay.
Thank you so much for
Thank you,
being
everyone.
here.
Thank you. Thank you. Just sorry. Apologies for leaving a little bit early, but I just got to rush. Thank you. Thank you.
We understand that, sir. Thank you so much.
Thank you very much.
Thank you.
So by the time Dr. Rajiv Singh comes back, over to you, Dr. Paras. Now we've talked a lot about the problems that arise in health because of contamination of water, either due to infectious agents or due to heavy metals or due to endocrine disruptors, plastics, so on and so forth. No, the way out. One, you have already proposed, that is hygiene, keeping hygiene, washing hands, and so forth. The other thing is the water that we drink. What is the best of cleaning or filtering processing the water that we drink? Because majority of us are there's a lot of, I would say, battle between two types of water filters, if to bring it to that one single point. I'm sure you're getting. So would you please give your expert opinion on this, because this is something which concerns all our viewers, and in which is the best water filter?
Yeah, that is the toughest question to answer, because Rajesh, am I audible? The technology is actually evolving, the science is
Yes, you're
evolving.
audible.
We always say what water comes by the nature. Nature has its own process of filtering water and giving us the purest of water through the rivers, through the springs, and through its natural supplies, uh, what we call as the mineral water. So this is what is naturally derived from the river or springs. So this water is enriched. This water is enriched with certain number of minerals in form of uh, calcium, magnesium, some amount of salt, some amount of selenium. So this is a enriched water with minerals, which is supplied by the mother nature, which is closer to the earth, and it is generally uncontaminated. So we call that this as a mineral water. Now, once the same water is supplied in our daily water supplies, it might get contaminated by various industries or the soil or the pipe leakages and all. So we do not have the reliability of this water as being a potable water. Though we, being in Delhi, are lucky to have very good water supply in terms of potable water that is safe. Then it comes to what does this water actually contains. So water we know is H2O, that it is two atoms of hydrogen and one atom of oxygen, which makes it water. But what we drink as the water is having other minerals also in form of calcium, magnesium, some again micro minerals and their respective uh, anions also. So we would have features of chloride, we would have their sulfates also in our water, and these all make up what we call as the water minerals. So now once we say that whether it is hard water or soft water, which water purifier is going to be best? So water purification has different purposes. One purpose of water purification is as akin to our today's program, that we want to get this water free of bacteria, viruses, and other microorganisms, so that we do not get these waterborne illnesses. So most of these filters would have UV filtration process. They would have charcoal filters. They would have different grades of filter to filter these membranes, to filter these microorganisms so that the water is safe for us. Then another system is reverse osmosis system, which makes this water more potable by making the hard groundwater a little softer, by decreasing the content of various minerals to a particular limit. As we say, the TDS of the water means how much is the total dissolved solvents in the water which are present, uh, total dissolved solids in the water, which is the TDS. And this TDS is by WHO standards. It is said that if the TDS is less than 300, it is supposed to be good for our health. Indian systems and Canadian systems guidelines would say that TDS up till 500 is okay. If the TDS is more than 1500, it can be deleterious to our health. So the best TDS is going to be, as per WHO, somewhere around 300 or lesser than that, and up till 500 is permissible as per Indian standards and Canadian guidelines. So these reverse osmosis are the purpose that they hardened water is softened by way of reverse osmosis, that these mineral constituents are decreased to a preset level of TDS. So that's what my understanding of this system is. So you have to have a good RO purification system which is capable of maintaining your TDS values to acceptable limits. It should not be totally removing all the constituents in it, because we need these minerals which are supplied through water also. Rajesh, over to you.
Yes, yes. Thank you. I think this was very important for
I
all of
would
us to understand. Am I audible?
So for
Am I
everybody
audible?
to understand is that जो mineral water हमारा supply होता है, according to various standards, these mineral water suppliers are supposed to keep their TDS in the range of 250 to 300. So mineral water means it has been derived from the natural sources actually, through the springs or the natural water supplies, and then it is packaged into the bottles hygienically and supplied to you. So when we go to the direct side, then you are actually taking these mineral water because the minerals are present in them because of the various uh, nature which is around that water supply or source, that they get mixed into that water, and we have authentic mineral water. But since we are into the cities, we can't reach those very easily. So we have our mineral water bottled to us and supplied to us and presented to us. So there are many studies that these mineral waters can help you taking care of daily equivalents of calcium. They give you your daily supply of magnesium and good amount of water intake that we all are supposed to take. Roughly 3 to 3.5 liter water for the males and 2 to 2.5 liter for the female we must be consuming, that supplies you your source of calcium, your magnesium, your adequate amounts of chlorides. They also come through your water, and some amount of iodine also you get through your water. Though for iodine you need iodized salt to supply you adequate amounts of iodine. So this is about water is precious. It has many things in your body to take care. Uh, Apart from the hygiene, it has to be rich in reasonable amount of minerals also. So we have to have a work on to all these RO system. That's why they say that even RO has a component being developed that they again mineralize it and to maintain the TDS at appropriate level to be healthy.
Yes, thank you. I think this is very important. हम सबको समझना जरूरी है कि पानी जीवन है, और पानी के केवल पानी ही नहीं, पानी के साथ जो और चीजें उसमें घुली हुई होती हैं वो भी हमारे जीवन के लिए बहुत आवश्यक है. एज डॉक्टर पारस वाज जस्ट टेलिंग अस कि बहुत सारी बीमारियां होती हैं कुछ तत्वों. We see people of the size of Bengal, Gangetic plains, they still have goiter and goiter-like illnesses. Dr. Paras, are you there?
राजेश, आपकी आवाज बीच बीच में थोड़ी कट रही है. आई थिंक बिकॉज ऑफ नेटवर्क. आई थिंक यू आर आस्किंग समथिंग रिलेटेड टू आयोडीन.
Yes.
Can you just repeat your question?
Please tell us about goiter in the due to issue of iodine.
Yeah. So, Rajesh, we know that there are certain areas when where supplies of iodine are inadequate in our northern region of India. So this concept of iodized salt was postulated so that everybody gets adequate amounts of iodine in their supply. We roughly need 120 to 150 micrograms of iodine as our daily requirement, and these iodized salt that we have are containing almost that much amount if we consume half uh, uh, TSF of that salt, that half teaspoon of that salt, roughly 3 grams of the salt would be containing our daily requirement of iodine that we are supposed to consume to take care of our thyroid health. So this iodine is utilized by our thyroid in producing our thyroid hormone, which is very vital for our metabolic system of the body. जैसे कि हम लोगों को समझाने के बोलते हैं कि थायराइड बॉडी की एक तरीके की भट्टी है जो बॉडी के हर प्रक्रिया को एक पर्टिकुलर लेवल तक मेंटेन कर पाती है। तो इसलिए आप सबको आयोडाइज नमक का सेवन करना चाहिए। हाँ, एक्सेस ऑफ आयोडीन से भी थायराइड डिसऑर्डर होते हैं, वो एक अलग कंसेप्ट है, बट बेसिकली अगर आप आयोडाइज सॉल्ट की सप्लाई अगर ले रहे हैं एडिक्वेट, तो आपके थायराइड फंक्शंस एडिक्वेट रहेंगे। जनरली आपको आधा चम्मच नमक पर डे ऑफ आयोडाइज सॉल्ट अगर आप ले लेंगे तो आपकी डेली रिक्वायरमेंट ऑफ 120 टू 150 माइक्रोग्राम आयोडीन पूरी हो जाएगी। जो आप डिफरेंट काइंड ऑफ रॉक सॉल्ट या हिमालयन रॉक सॉल्ट लेते हैं वो आयोडीन डेफिशिएंट हो सकते हैं। तो आपको अपनी डेली सप्लाई में आयोडाइज नमक का भी एक अंश अवश्य लेना चाहिए।
Thank you so much. Thank you. Dr. Rajiv Singh, are you there? Dr. Rajiv Singh, sir, आप हैं? Dr. Rajiv Singh, sir, are you there? So I think Dr. Rajiv Singh is not able to connect or join. He had some connectivity issues earlier as well. So I think we had a very enriching and a very useful discussion today about waterborne diseases, about the infectious disease, and about the diseases and disorders caused due to the content of the water that we are actually consuming. I would now request Shri Anil Rajputji sir to give a vote of thanks and to conclude. Sir,
Thank you.
Are you
Thank
there,
you
sir?
very much. Thank you very much, Rajesh, for conducting this session and keeping the audience very gripping and asking all the relevant questions that most people want. I want to thank you, Dr. Angwal and Dr. Bagai, for explaining all this in a very simple language to all our viewers and participants. And I'm sure they would have taken relevant notes to improve their quality of life going forward. As the program is illness to wellness, we don't want people to fall sick or become seriously ill. The idea of our program is to give them preemptive knowledge. And Dr. Bagai shared with us, how many multiple diseases can be caused with the waterborne diseases. Rehydration of a child can save life. So I think these are some of the important messages that have been given, and I'm sure people would have noted them. Vector-borne diseases, sharing knowledge on that, what are the symptoms, what are the preventive measures that can be taken. A message that came across that don't try to self-medicate yourself. If you have a problem, you please go to the expert and take his suggestion. Dr. Gangwal gave a very, very critical and important suggestion that, hygiene management is very critical. And that can actually help many people not falling sick and preventively take appropriate steps. And there is a need to do capacity building program in that space where, even the house help needs to be taught as to what are the precautions that they need to take while doing work and cooking for you, because ultimately a very large population of our country uh, has house help which is cooking for them, and they themselves don't go to the kitchen to cook their meals. So if they don't have the right practices, then many of the people who are consuming food prepared by them can fall prey to many diseases. And the impact of this is on your multiple organs. So it is critical that the right cooking practices and self-management of treating your disease is not encouraged. So I want to thank uh, all the panelists for coming and joining us, share their knowledge and experience with us. I also want to take this opportunity to thank SHM team for organizing such a wonderful panel for our program. Thank you very much and most grateful to you. Thank you.
Thanks, sir.
Thank you so much, sir.
Thank you.
Thank you so much.
Thank you.
Namaskar.
Thank you, everybody.
Thank you.
Thank you, Dr. Paris. Thank you.
Thank you, dear all.
Thank you.